Hi everyone, welcome back to Graham DVM. I want to talk a little bit about spaying and neutering dogs and cats today. Something that you as a dog and cat owner, especially if they're a puppy or a kitten, are going to encounter when you bring your animals into your vet. It's a discussion that's important to have, and I'm hoping this video can serve to help you plan a little bit, or at least know how to ask the right questions as you prepare for this surgery. So across the board, spaying and neutering has primarily served the purpose of population control. We all know accidents happen, pregnancy occurs, and as an owner, you might be left with a litter of kittens or puppies you have to find a home for, or you'll have to take them on for yourself. In a lot of cases, they end up in shelters and euthanized. So of course, not only will they become a strain for the system, but they'll also be lives lost to euthanasia when their system is no longer able to support them. We also have reasonable belief that things such as roaming behaviors, marking behaviors, and in some cases aggression can all be reduced depending upon the timing of a spay or a neuter. Now, some of those theories have since been argued, some have been disputed and some disproven, depending on the breed or the particular onset of these behaviors, but as a general feeling or philosophy, some of them have indeed been validated for certain breeds and the certain timing of those behaviors developing. So why did I go ahead with making a video about spaying and neutering if it looks like the advantages are so obvious? Well, like anything else, research has come out more recently that adds a few dimensions to our considerations as we plan a spay or neuter for particular dogs. Specifically, we've found that spaying or neutering certain breeds less than 6 months of age may play a role in the development of specific orthopedic diseases. Most notably hip dysplasia, cranial cruciate ligament disease, or ACL tearing, and elbow dysplasia, which is a disease process of the elbow, are all shown to be more common in certain breeds if they're spayed less than 6 months old. Now realize this data only comes out of those particular breed groups, the Labradors, the Golden Retrievers, and the German Shepherds. And even within that group, certain are more prone to the development than others. Why does it happen? Well, it seems to be that it occurs because we have the lost effect of the gonadal hormones on those growth plates. When you have gonads, ovaries or testicles, that helps to instruct the physis or growth plate when to close. When you don't have the effect of that, growth plate closure is left kind of to its own devices, and in some case you have late closure of those growth plates causing theoretical deformity of the joint. And in some cases, that's going to cause a knee that's more prone to tearing of an ACL. That's going to cause an elbow that may not be inlined appropriately. And it may result in a hip that allows some laxity and what we know to be dysplasia. From a cancer realm, we've seen much more in the Golden Retrievers than in the Labradors or the German Shepherds. But specific to those dogs, the earlier spayed dogs tend to have a much higher risk of lymphomas, mast cell tumors, and hemangiosarcomas, three very common and nasty tumor types in Golden Retriever dogs. So what's the purpose of me putting out a video like this? Certainly I'm not suggesting not to spay or neuter your animal, or they'll end up with torn knees, bad hips, and cancer. No, the purpose of this video is to ensure that my viewers take the time to talk to their vet, find out what the research shows for their specific breed. Chances are there's been research released since the making of this video that will alter the decision-making process for the spay or neuter of any breed. And so keeping up on it can be extremely difficult, and chances are good your vet will have to pull up an information network and see what the newest recommendations are. And even if they're not recommendations, because when it comes to this topic, recommendations are generally awkward, challenging. You're pulled with different pressures as a veterinarian, one population control, one risk assessment for certain diseases. But I think the important thing here is opening up that discussion, realizing what the pros and cons may be and how our risk comfort level is as an owner. What things are we willing to accept? What things are we not willing to accept? I think that those are the kinds of decision-making processes that just should start to happen when we go forward with the plan of a spay or neuter. So once again, guys, I hope this video helped you with your pet-related questions and concerns, and I'm absolutely open to questions you'll have, so post them below, and until next time, thanks for watching Graham DVM.